Good evening, members. Leslie McFadden on behalf of the Sacramento County Board of Supervisors, here to urge you to restore funding, the $3.9 million for the Black Infant Health Program. Unfortunately for Sacramento County, the Black infant mortality rate is more than twice the rate of all other infants in our county, and we'd like to be able to serve more women like Ms. Kilson, who you heard so eloquently from earlier. Thank you for your consideration.
Thank you.
Sean South on behalf of the California Primary Care Association and the Oral Health Access Council. I think a lot has been said. I think it's important that we have this opportunity to invest. We need to stop dealing with the aftermath of these problems and really start to get to the root of them and deal with the prevention. These programs are evidence-based. We know what happened when they existed. We know what happened when they went away. And it's time that this legislature take the opportunity to really reinvest in things that work. Because at the end of the day, we need to prevent, we need healthier communities, and these programs are a key to that success. So whether it's preventing STDs or increasing birth weights of African American children, all these programs are essential to the health of our communities, and so I thank you.
Good afternoon, Madam Chair and members. Khalif Asagai on behalf of NAMI California. Our organization is the state's chapter of the nation's largest mental health organization, the National Alliance on Mental Illness. We have 19,000 members in the state through our 67 affiliates. We're here to support the restoration of funding to the Early Mental Health Initiative. Undiagnosed, untreated, or inadequately treated mental illness can severely interfere with a student's ability to grow, learn, and to develop. Because students spend so much of their productive time at school, we believe that services should be provided at the school site or facilitated to be provided in other places, or excuse me, I should say, or we should facilitate services from outside to be provided at the school site. The ME program, reinvesting the ME program, will produce savings for the state, reduce costs associated with mental illness later on in life, reduced absenteeism, and reduced referrals to the juvenile justice system. So we strongly encourage you to restore funding to the ME program. Thank you.
Thank you.
Good evening, Danielle Mollet with the California Alliance of Child and Family Services, here in support of restoration of the Early Mental Health Initiative as well. In addition to the reasons already stated, we believe that it's very important to intervene early, to provide those early intervention mental health services, to build resiliency in children, and to prevent entry into special education for serious emotional disturbance. Thank you.
Hello, Michelle Stoll-Parvensky from the Children's Defense Fund California, here on behalf of the California Children's Health Coverage Coalition, which includes Children Now, the Children's Partnership, California Coverage and Health Initiatives, United Ways of California, and PICO California. As we've heard, early intervention and prevention in children's health not only leads to healthier children, families, and communities, but also saves money in terms of long-term health costs. For those reasons, our coalition is supporting restoration of three key programs that have been eliminated in the past budget cuts. Those include the Early Mental Health Initiative, which provides important early intervention to help prevent future problems and help improve the mental health of our state's children. We also urge you to restore funding for the Black Infant Health Program, which is really critical to address the disproportionately high rates of Black infant mortality. And finally, we urge you to restore the California Children's Dental Disease Prevention Program, which is critical in providing the dental disease prevention and other programs so that we can ensure that we don't have problems with those children later on. So we urge you to support restoring these proven programs to create a healthier California and healthier future. Thank you.
Hello, Angelica Gonzalez with Kaiser Permanente here to support the restoration of the funding for the Black Infant Health Program. We know this program works. Kaiser has provided funding for this program through our Community Benefits Program, and we hope you support the restoration of the funding for this. Thank you.
Good evening. Shannon Smith Crowley, American Congress of Obstetricians and Gynecologists in California. First, I just want to make a brief comment about a previous item on the prenatal genetic screening program. The department has done a stellar job about improving the program, and the uptake and the use of the program has just changed substantially. And again, the department has done a lot on all of these programs with limited resources over the last few years, but we support in general the school-based health centers, adolescent family programs, STDs, but particularly with the Black Infant Health Program, this population is, the numbers are just so different from any other racial or ethnic group that there's unique stressors in this group. In addition to, we talk about the infant mortality rate and the preterm birth rate. When these children are born, they're born lower birth weight, which has its own problems, and that African American women have almost four times the death rate of any other group. And also, when you're talking about pregnancy and birth, you're talking this fiscal year or next. There's, of course, long-term savings, but there's immediate short-term savings, and we think this is a great investment and ask you to support restoration of this money.
Lydia Bourne, representing the American Academy of Pediatrics. I want to align myself with the comments of my colleagues. $3.9 million would leverage 3.7 from the feds. That's a little less than $8 million. And when we restore that funding, we can reopen the Riverside and the San Bernardino Black Infant Health programs. We can bring to full staff the Fresno, Kern County, San Diego, and Sacramento programs. This will help us to prevent, as others have said, black babies being born too soon and too small. Thank you.
Good evening, Brianna Pittman with Planned Parenthood Affiliates of California. I want to thank the Assembly for prioritizing refunding cuts to the Department of Public Health programs and highlighting it as a priority in the blueprint for the budget year. There's a number of programs that Planned Parenthood would like to see refunded, including the Black Infant Health Program, the Adolescent Family Life Program, teen pregnancy prevention programs. We'd also like to see funding for STD prevention, which is a rising epidemic here in California. In 2007-8, the state, there was $46 million in state and federal funds that went to teen pregnancy prevention programs. Almost all of that money has been cut, including the complete elimination of the Community Challenge Grant, which was $20 million. The $10 million that's in the budget document that you have is the amount that the state spent from the general fund in that 2007-8 year. So we would love to see the state get back to that point. Think that these are some important programs that have been proven effective, and would love to work with you and other stakeholders in finding ways to reinvest. Thank you.
Good evening. Thank you, Madam Chair and committee members, for holding this important hearing about restoring a lot of critical public health programs and restoring funding to a lot of the programs that were mentioned earlier. My name is Amy Moyen. I'm with California Family Health Council, and I want to be specifically on record in support of restoration of funding for teen pregnancy prevention programs, as well as funding for school-based health centers, as they're a key gateway for funding in communities for adolescents. I'm also here today to urge the state to invest in STD care for the remaining uninsured. Data released recently by the CDC revealed that rates of chlamydia, gonorrhea, and syphilis are increasing nationwide, and over 1.4 million cases of chlamydia were reported, which represents the greatest number of cases for any condition ever reported by the CDC. And unfortunately, here in California, those alarming trends are being echoed here throughout the state, particularly in hotspot counties. So statewide, we're seeing STD rates at its highest over 15 years, and in hotspot counties like here in Sacramento, Kern, Fresno, Alameda, San Francisco, San Joaquin, San Diego, the list goes on, the rates are about 2 times more than the state average. So what we're asking for today is an investment from the state, at first at least a short-term, modest investment in addressing the growing epidemic of STDs occurring right now in hotspot counties across the state by investing $2 million in support of delivery of STD services to cover the diagnosis, screening, treatment of STDs, as well as outreach and prevention, micro-targeting hotspot counties, and populations that are disproportionately impacted. So thank you for your consideration.
Thank you.
Good evening, Madam Chair and members. Valerie Small-Navarro with the American Civil Liberties Union, and I'm going to be extremely brief. I'm just going to touch on one subject, which is the teen pregnancy prevention, which you could also think of as sexually transmitted disease prevention. And I just want to mention that in 1992, California had the highest teen birth rate in the nation, and that rate, we were able to bring it down with the teen pregnancy prevention programs. There's a whole bunch of programs that fall under that rubric, and I just encourage you, I know you've had a lot of information this evening, but teen pregnancy prevention and STD prevention are among the most important issues that I think we all face as a community. So thank you very much.
Thank you.
My name is Phil Curtis. I'm Director of Government Affairs at AIDS Project Los Angeles. I'm here to voice my support for a reinvestment in public health funding in HIV/AIDS programs. I hate to bring you more bad news because you've heard plenty, but we know some things about the HIV/AIDS epidemic in California. We know what population groups are most heavily impacted. And right now, HIV/AIDS infections are on the increase among one population group specifically, and that's gay men, and specifically young African-American gay men. A recent UCLA study documented a 6% increase in the rate of new infections among young African-American gay men in Los Angeles County. I asked the researcher what that meant over time. He said, well, it means in 12 or 15 years you've got saturation. I said, well, what's saturation mean? He said, oh, about 60% of that population will be HIV positive. That's really the bad news. The really good news is that we have the tools to roll back this epidemic. We have biomedical interventions, PEP and PrEP, that if widely applied across these at-risk communities could stop these infections before they happen. And that's why we need to reinvest public health funding in HIV and AIDS programs. Thank you very much.
I'm Ann Donnelly with Project Inform, and I just want to echo my colleagues' thanks for this committee looking at these critical issues. And of course, I support the reinvestment of funds into HIV and AIDS areas. And I wanted to point out one particular project, which is our public health demonstration project. We very much commend and appreciate California for moving forward and expanded coverage, but as everyone said, where we're not doing as well is on that front end, where we're reaching out to vulnerable people at risk for HIV and screening outside of medical care. Also, with new coverage, there's two other important public health activities we need to look at, and that has to do with linking to care and then retaining, very important, retaining people in care. We also have some opportunities in California because there are some amazing community-based organizations, particularly actually in San Diego, Christie's Place, who are doing really incredible work, keeping people connected to care through innovative technologies such as using trauma to inform their delivery of services. So we are proposing $2 million for 3 demonstration projects that would look not only at these outreach, linkage, and retention and care, but also at evidence-based and innovative programs that will both improve health and also dramatically reduce infection. Thank you very much.
Thank you, Chair and members. Kathy Mossberg, and I'll try to be brief as well. Just to piggyback on the comments from my colleagues regarding the HIV and AIDS augmentations, we certainly would like the state to look back into reinvesting in syringe exchange programs. They're incredibly cost effective. They hit a certain population that you're not going to catch in other places. And again, so what we're asking for is $5 million. Because of federal that we're not allowed to use Fed dollars for those programs, state dollars are incredibly important and can be used and utilized in incredibly cost-effective ways. On behalf of the Public Health Institute, I want to support the augmentation for the Black Infant Health Program as well, and we encourage you to make those augmentations. Thank you.
Laura Thomas, Drug Policy Alliance. We strongly support returning funds to the general fund to support syringe access programs, as we ran a number of bills to get those funds into the state budget, and we're very discomfited when those dollars were taken out. And since those dollars were eliminated from the budget for syringe access, a number of programs across the state have closed, eliminating that opportunity for people to be linked into care, into HIV testing, into Hep C testing, and into primary care and substance abuse treatment. So we strongly support restoring those dollars. Thank you.
Hi, Eileen Espejo from Children Now. Just wanted to align ourselves with the comments made by previous commenters to restore funding to the Black Infant Health Program and also the Early Mental Health Initiative. And with regards to school-based health centers, really wanted to highlight how they play a critical role in making healthcare services and screenings readily available to children where they are during the day. So we certainly support efforts to ensure that these centers thrive and serve children so that they are present and ready to learn while in school. Thank you.
Kat DeBerg with the Health Officers Association of California, and in the interest of time, I'm just going to echo, before he states them, the comments of my colleague Jim Beebe.
Hi, I'm Dr. Jim Beebe. I'm Laboratory Director for the San Luis Obispo Public Health Laboratory and President of the California Association of Public Health Lab Directors. I've come here to ask for the restoration of partially of a unique program called Lab Aspire, which will allow for the training of laboratory directors. There are 35 public health laboratories in the state at the local level, staffed by very dedicated people who test for tuberculosis, HIV, influenza, and scores of other agents, blood from toddlers for lead poisoning, and numerous other activities. The credentials requirement for lab directors is extremely high, and there's a critical shortage. The problem was recognized and a solution devised in 2006 with the Lab Aspire program. However, it was defunded in 2012. The solution is there. We ask you to consider restoration of that program at less than half the original funding level. Thank you very much.
Good evening, Madam Chair, members. My name is Norma Thigpen, and I'm a member of the Solano County Black Infant Health Advisory Board. I would be remiss if I didn't say something. I served prior to retiring in 2012 with Solano County and with Santa Clara County, worked in the Black Infant Health Program, was part of the Black Infant Health Program in 2008, 2009, and I saw the change in terms of being able to serve. Well, we had 12 staff, and then we were reduced to 3 to 4 staff later on. The infant mortality rates are on the rise. I remember specifically around 2008 when African American infant mortality rates were really approaching the Healthy People 2010 rate of 4.5 deaths per 1,000 live births, and that was really astounding for some of the Black infant health counties to be able to reduce infant mortality rate for Black women, African American women. So I thank you for the opportunity, and we ask that you restore the funding to Black infant health programs, but also to all maternal child health programs as well. Thank you.
Judith Riegel with the County Health Executives Association. I first want to thank the committee for the focus on the importance of, investing in public health strategies, and also just to speak specifically in support of the partial restoration of the Lab Aspire laboratory training program.
Good evening. Trish Agee with California Black Health Network in support and restoring the 3.9. A lot has already been said by our fellow colleagues, so we just want to thank you from California Black Health Network for putting this on the agenda. We ask that you please make this priority, and we will continue to work with you and your staff in getting any information that would help push this and get this done. Thank you.
Good evening, Madam Chair and committee members. Thank you very much for the opportunity to speak to this topic tonight. I'm here to talk about the Early Mental Health Initiative. My name is Scott Lindstrom. I'm board president of an organization called Time for Kids that does advocacy for supports for our elementary school children. Also a school psychologist for 30 years that's implemented this program, and a parent whose daughter has gone through this program. So the Early Mental Health Initiative was basically a victim of timing. It existed in a pretty healthy manner in Department of Mental Health, was eliminated as it was moved to the Department of Education. The Assembly and the Senate had both voted to restore funding, maintain funding in the move, but it was eliminated by a veto from the governor. So it really was a victim of timing. There was never a question about its effectiveness or about the low cost compared to the benefit. In fact, the effectiveness was proven for kids from all across the state, every geographic area, every ethnic background, foster kids, English learners, poor kids. Every kind of child that was in this program demonstrated benefits. Second, in terms of where Emmy fits, there's a huge gap for these kids. There is nobody serving elementary school age kids. We do things for preschool, we do things for high school, but these elementary school kids are missed. As of AB 722 in 2003, the elementary counselor ratio to counselor to student was 1 to 3,009 students. That's less than a third of what we have at the high school level. Brain science, trauma-informed practices, tragedies across the country all tell us we need to focus on these kids, intervene early, catch them while we can, while they're young. Emmy did 3-year matching grants. School districts had to provide 50% of that funding. With early interventions with identified kids, 15,000 kids were served across the state with that $15 million, and another 15,000 were served in prevention programs. Examples, I had a student just this last week. I met with one of our guidance aides in Chico, where I'm from. Had a student who had gone through the entire year to January before ever speaking a word in class. The first time she spoke at school was in one of our program services. From there, she grew.
Could you sum it up quickly?
Yes, I could. Finally, the prevention piece serves another 15,000. That's with social emotional learning, addresses school climate, prevents bullying, all of the issues that are relevant for all of us here, and it's important that we find a way to restore the funding for this. Thank you.
Thank you.
Hello, I'm Cynthia Phillips. I'm founder and director of To Be Successful Youth, and I came to speak on briefly on the behalf of the Black Infant Health Program for our county, but I'm not going to expand on it because Norma did. So I just kind of want to ditto, but also on the other youth programs, we have an after-school program, and so where we do our program, which is a year-round program, we work with students who are in special education, alternative education programs. And so when I'm listening to everybody, I'm hearing the mental health piece, I'm hearing the premature birth weight and the developmental and a lot of the things, and the environmental, but a lot of things can be prevented. And so what I find for in the after-school program for that population, so it kind of covers the gamut, because if they start off here and they don't have intervention, they end up over here, where we're talking about we need kits and we need needles and we need all of that. So I'm just kind of here to say that those children need the services. Even the regular after-school programs, they are not normally welcome there. They're not a fit there because of the behaviors and the traumas that they've experienced. So not only that they have challenges at school, they have challenges in the community. They're not even wanted in most after-school programs. So they need the resources wherever they can come to get them so that they can become healthy later. Thank you.
Okay, thank you very much. I think, anyone have any? Dickinson, you had some comments? Yes.
Well, I just want to make a couple of quick comments. First of all, I appreciate everybody's testimony, and it's all extremely compelling. I did want to say that there are a couple programs in particular that we've heard about, but I think are also clear candidates for, in my mind, for restoration. And the first is the Black Infant Health Program. You heard a little bit about the circumstances here in Sacramento County, where the disparity is alarming, and nothing short of that, and that's the condition in some of our counties elsewhere around the state. It's truly something that I don't think we can be satisfied to see continue, and that, in my own experience as a county supervisor, was a very effective program. So that's one that I certainly think bears further consideration, and also the early mental health screening program. And I won't repeat what we've heard about its effectiveness. I'll only say that I was so impressed that we should restore that program. I introduced a bill last year to that effect. Unfortunately, it didn't make it through the process. But this year we have a real chance, I think, to put that program back in place. and help literally hundreds of children and change their lives. So I just wanted to mention those two. That's not to diminish or denigrate any of the others, but I do think there are some that clearly stand out too. Thanks.
Okay. I want to thank all of you for coming. I think we all heard some very compelling stories. This is, I guess it's encouraging because we do plan to try to restore some of these programs. And that's encouraging in light of what has happened over the last 4 or 5 years, where we've had to decimate some programs significantly and are concerned about what we're doing in terms of public health in the state of California. And so this gives us an opportunity to think a little bit differently this year in terms of how we're going to move forward this year and hopefully years to come with regards to restoring those elements in our society that we think are really important in terms of public health. Clearly dealing with health disparities is a major issue. Preventing, in my mind, pandemics like the spread of HIV in African American communities is a critical issue that's often ignored in our battle at the federal level and every level in terms of HIV. I've traveled fighting AIDS in South Africa for many years, 8 or 9 years, and I know that as they've grappled with the issue, we have not adequately grappled with it here in a culturally sensitive way. So it's alarming when you think that maybe 60% of a population could be affected. I'm concerned about the males, but I also know the female population is very high in terms of HIV. And some have said it's probably the leading cause of death among African American women between the ages of 19 and 39 or something, which is really quite unfortunate that when we look at that way. So there are a lot of things that we have to do in order to prevent that, and it's interesting and alarming because it is so preventable. You know, it's one of those things that is preventable, and we've done a fairly decent job with some populations, but not with others. And a lot of it has to do with cultural relevance, competencies, and things like that, where we really have to put the resources in. Otherwise, we're going to have a very sick population that we'll be caring for in other ways, because we just heard how expensive the medication is. And so to prevent the infection from the beginning, obviously, is a smart thing to do. I spent years building health clinics in schools, and so I, as a school board member, I know the value of having health clinics at a school site. Helping those schools to develop those clinics and get the kind of services directly to students. In poor communities, oftentimes a health clinic is the doctor. And I had one school where a nurse was seeing over 1,000 kids a month at an elementary school for ear infections and colds and things, because when they were ill, the mom said, just go talk to the school nurse. And you know, and we've cut school nurses so that we have very few school nurses now, so I guess it's go talk to the aide or whoever it is on the playground, because we don't have oftentimes very good health services in our schools anymore because of that cut. So we've got a ways to go, and I'm optimistic that we'll try to develop some priorities of what things need to be as we're about to slide off the cliff, what things need to be grabbed very quickly and pushed forward, and as well as those things that have multiple effects in terms of when you do some level of prevention, you then basically are able to save a number of other things that are related and can move forward. So I pay homage always to my colleagues who got here before I did, because they had to make very difficult and painful decisions. And they all still have a sense of pain about what we did in the past. I mentioned this morning at one of, I forgot what group I was in this morning early, but I think it had to do with ARC. And I said, you know, this state made lots of cuts because it had to make cuts. It didn't have the money. We have to not act like we don't have the money anymore. We have to act like we have the money. It's almost like a family that has to cut back and have one meal a day because they lost resources. Then all of a sudden you get the resources back and you forgot that there really is 3 meals a day you need to have and not just one. So you keep eating the one thinking that's what you have. We have to think a little bit differently. We have to be prudent with the resources we have. But we also have to recognize the fact that we can reinvest, and we must reinvest. Californians invested and understood the cuts that we had to make, even though as painful as they they were. But they probably won't understand it if we don't go back and restore as we get resources coming in. And so hopefully in a very prudent manner we'll be able to respond to a lot of these issues and give us a better public health picture in the future. Once again, thank you for coming. I thought we'd have been here till tomorrow, but I am so happy that we're not, and this hearing is adjourned. Thank you so very much.